Okay, good evening, one and all. Myself, Dr. Rupasri, consultant in obstetrics and gynecology, Hyderabad. Now, let us discuss some of the important questions in the fetal skull, okay, which have been asked in the previous examinations. Okay, the presenting diameter of fully flexed head means C. What is the option? It may be suboccipitobregmatic, suboccipitofrontal, occipitofrontal, occipitoposterior. The answer is suboccipitobregmatic. C. Because suboccipitobregmatic diameter is about 9.5 centimeters. Suboccipitofrontal is about 10 centimeters. Occipitofrontal is 11.5 centimeters. And occipitoposterior, it is not a presenting diameter. Okay, it is a position in which the fetal head. It is just a malpresentation. Okay, and see here for the clarity I have given. See, this is the shortest diameter, that is the 9.5 centimeters. Okay, which is the shortest, the fetal head will be engaged in that only. That is, it is fully flexed condition. Okay, and the 12.5 centimeters, it is not present only, and it is vento-vertical, about 13.5 to 14 centimeters, and it is sub-occipito-bregmatic, about 9.5 centimeters. So always in a good, that is flexed head, the position will be, the presenting diameter will be sub-occipito-bregmatic. Okay, the next question. After delivery, cat foot succeeded and disappears within. Okay, it disappears within. As I have discussed, it disappears, it is present at the time of birth and disappears within 48 to 24 to 48 hours. Okay, see. Normally, the fetal head should be like this. But because of the accumulation of the fluid in the layers of the scalp, the swelling appears. It is present at the time of birth and disappears after 24 to 48 hours. Okay, next. The longest transverse diameter of the fetal skull. See, in this, why this question is repeated so many times? Because they are asking the longest diameter of the fetal skull. But the key is present in the transverse diameter, not the AP diameter. Okay, suboccipitobregmatic. It is about 9.5 centimeters. Vento-vertical, 14 centimeters. Biparietal, 9.5 centimeters. Okay, bicoronal is not there only. It is bimastoid, bitemporal, or super or subparietal. So see, the answer lies in the transverse. Therefore, it is about biparietal 9.5 centimeters. Normally, if they ask about the anterior posterior diameters, then it is vento-vertical. Okay. See, it is a biparietal diameter which is about 9.5, bitemporal about 8. I am asking about the transverse diameter. The question I have asked transverse. In other examinations, it may be anterior posterior diameter also. So please, my intention is to understand the keyword in the question. Okay. Next, bro presentation is seen with the engaging diameter of bro presentation. That is, bro, it is partial extension. Okay. Vento vertical, it is partial extension with the bro presentation. And submento vertical, it is face presentation. And submento pragmatic is also face presentation. These both are incomplete extension and complete extension. And last is occipitofrontal with vertex presentation. Okay, see the diagram. I have shown here, it is a vento-vertical about 13.5 to 14 centimeters. Okay, see, it is a bro presentation, that is partial extension. Now, shape of the anterior fontanelle is diamond shaped. The triangular is the posterior fontanelle. No circular or no elliptical in the fetal skull. Only diamond means anterior fontanelle, that is diamond shaped. See here, for the clarity, see, I have kept a clear image regarding it, that this is the anterior fontanelle or the bregma. It is diamond shaped, and see the posterior fontanelle, it is triangular shaped. Okay, if you remember these images also, you can answer so many questions, and one point is you can eliminate also so many answers from it. Okay, next, sutures help in what? The sutures help? Gliding movement of one bone over the other, collection of blood and help in the exchange transfusions, help in palpation of the intracranial status, cerebrospinal fluid can be drawn. See, sutures means it help in the gliding movement of one bone over the other for the easy passage of the fetal head through the resistant birth canal. Through resistant birth canal. Okay, all the collection of blood, cerebrospinal fluid, all the palpation of intracranial status, everything goes to the fontanelles. Okay, next. Most common presentation in case of anencephaly is, anencephaly means there is no proper development of the fetal skull. Okay, no brain development. Only the face will be the presenting part. So, what is the answer? Most common presentation in case of anencephaly is face presentation. See, I have kept a image, a beautiful image. See, no cranium, no vault, nothing, no brain, nothing is there here. Only the face is there. You can remember it as only the face present and it's a face presentation. Okay. Next, antifontanelle is ossified by. It is ossified by 18 months. 18 months. If it is not ossified till 24 months, it is pathological. Okay. See, this is antifontanelle, diamond shape, ossified by 18 months. Okay, this is a poster fontanelle. This is triangular in shape, with which is ossified by term. Okay. Next. All are true regarding the caput succedanum, except, as I have said, the baby with a cap. The cap contains some fluid. Okay, you remember this quotation. You can eliminate the difference between the caput and the cephalhematoma. See, it is a localized collection of blood in the layers of the scalp. No, it is the fluid. See, in the first sentence itself, you have got the answer. So, you can be now tension relieved. Now, you just observe the other options which are present. Swelling is diffuse and boggy. It is right. And swelling is not limited by the sutures line. It is right. And it signifies the static position of the fetal head for a very long time. Okay. So, it is just collection of fluid in the layers of the scalp. Next. See, as I have said, see, it is just a fluid bulging. Just a cap with a fluid. Now, molding. What is molding? Is it a wide gap in the suture line or swelling because of the accumulation of blood in the skull? Blood means cephalohematoma. Okay. Swelling because of the accumulation of fluid. Fluid means caput. And it is alteration of the fetal head while passing through the resistant birth canal. Molding means some changes. Some changes or some alteration should be taken place in the fetal skull. Okay. Therefore, here the option is the fourth option, last one. It is alteration in the fetal head while passing through the resistant birth canal. Wide gap in the suture line is the fontanelle. Okay. Okay, these are 10 questions which have been repeatedly seen in the examination papers. Okay, please go through it once again. And this is C. Molding I have said now. This is the alteration in the shape of the head of the presenting part. See, this is the elongation of the ventovertical and compression of the suboccipito-pragmatic. Okay. Okay, once again, you please go through all these questions. You'll get an idea and so that it will be helpful in your examinations. Thank you.